Hey guys, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. Today we're going to be talking about just heavy periods. Now, I know you've all been there, ladies, and that's why you're here today. And if you're interested in learning more, please check out a consultation with me. My consultation number is 840-688-0297. I really want to help get to the root source of your problems. Now, let's get to it. So, heavy periods. I used to have them for a long time. I remember being at work, seeing patients, and having to run to the bathroom to change my pad and my tampon because it was saturated like almost every hour. I was so afraid. Here I was, a gynecologist trying to treat women's heavy periods, and I was struggling with that on my own. And I was trying to figure out, what is the cause? Why is it that birth control pills somewhat help but don't really get to the root cause of the problem? And I, with so many occasions, would order ultrasounds on women to check out their female organs to evaluate their heavy periods, and like 90% of the time, they were completely normal. And then I had to tell patients, yeah, your ultrasound's normal. I don't really know why you're having a heavy period. Well, after all kinds of clinical research that I've been doing, and as a clinical researcher at Loma Linda University Health, I can tell you that I do have some ideas that could really bring women towards the understanding about why that is. Now remember, the uterus is one big smooth muscle. It's actually made of the same tissues that our veins and arteries are made of. And so because of that, they receive inflammation just like any other vein or artery or even organ receives, and like can be an example of impending cardiovascular disease, diabetes, and metabolic risk in the future. Now, that helps explain fibroids. But what about the lining of the uterus? Now, what about like when you get an ultrasound and you're looking for a fibroid, but you don't see one, but maybe you have heavy periods? Well, look, in the lining of the uterus, that actually has tiny, tiny microscopic blood vessels. And so what usually patients tell me is on day 2, their period is crazy heavy. Now, why is that? On day 1, your body is starting to constrict your uterus, contract your uterus to get that tissue off the lining of the uterus. On day 2, that lining of the uterus now is bare, it's raw, and all those blood vessels are just bleeding. And it requires healthy blood vessels at the lining of the uterus to do their job and to constrict and to stop bleeding. But there actually is research that looks at how those blood vessels, those microscopic blood vessels on electron microscopy, are actually impaired with women who have heavy periods. We call it AUBE, abnormal uterine bleeding -E, endometrial, because those blood vessels are recipients of blood vessel inflammation, the same inflammation that causes all kinds of cardiovascular disease problems. And so if a woman gets an ultrasound ordered for heavy periods and we don't see anything big like a polyp or a fibroid, a lot of times it has to do with microscopic blood vessel inflammation that the pelvic ultrasound can't see. And so what is the solution? Well, try to figure out what your inflammatory trigger is, and that's where I come in, because we know that there's all kinds of inflammatory triggers for women that include high insulin levels and inflammation. High insulin levels often come from stress and anxiety or not sleeping, but also from high carbohydrate diet. And I know that most women are really looking to try to have good health. I know that a lot of women aren't eating ice cream all day long or Starbucks drinks, but they have a lot of this carbohydrate exposure from beans, from rice, from quinoa, from fruit. All of these things for some women are incredibly inflammatory. They raise insulin levels and they damage blood vessels at the lining of the uterus, and they don't allow those blood vessels to constrict when it's finally time to stop bleeding on your period. That's why women have long 6, 7, 8 day, 9 day periods. Really, your period's only supposed to last 4 to 5 days. If you're having periods longer than that, those blood vessels aren't doing their job to constrict, and we have to help support them. The reason why birth control pills help is because they actually thin the lining of the uterus so that when you do bleed, it's not as heavy because the lining is not as thick. But if you're interested in looking for something different, women can do really well by looking for their inflammatory trigger and reducing insulin. And that is really what helps women. And that's what, for me, in my journey with endometriosis and heavy periods, when I looked for my inflammatory triggers, which is stress and carbohydrates and lectins, man, my period got so much better. So for you women who are looking for solutions when you have just heavy periods, you're not sure why, check out your inflammatory triggers. I have several videos on them. I would love to help you through this journey. So if you like this video, go ahead and like it, subscribe to my channel so you have more lifestyle solutions in order to help your gynecologic problems. Have a great day.